Thank you, sir. So my study title, as sir has already told, so that the study was purposely made to focus of that India is having rapidly growing elderly population. So you can see in 2020, 2050, almost 20% of us will be elderly population. So one of the major consequences of the aging is loss of skeletal muscle mass and skeletal muscle strength, and loss of muscle mass and the function is called as sarcopenia, and the global prevalence is around 15%. So, due to fat deposition and inactivity, the muscles lead to myosistosis, which leads to sarcopenia. And due to physical inactivity, again, the muscle atrophy occurs, so which again leads to sarcopenia and additional risk factors, obesity and osteoarthritis. So our study's aim was to assess the relationship between muscle strength, hand grip, BMI, body composition in healthy population, and the primary objective to compare body composition and muscle strength of individuals in age group 20 to 60 years with different BMI groups. So this was a cross-sectional observational study with an inclusion of healthy individuals from age group 20 to 60, and we excluded all the chronic diseases, and we had a major anthropometric measurements with body composition variables and hand grip and muscle strength in different muscle groups. So we include about this is the first phase which I'm presenting. We have enrolled around 700 patients, but I'm presenting data of 100 patients only. So this is the hand dynamometer we used, and this is the bioimpedance machine we had used. So when we looked at the result, the interesting part was to see as the compare the BMI and the percentage body fat. So we found that there's some hidden obesity. If we classify the patient based on BMI, only 39% of patients were having obesity, whereas if we classify the patients on percentage body fat, approximately 61% of patients were having obesity. So there's a need of BIA in every clinic in India to recognize more obese patients. Then coming to muscle mass and hand grip, so we found that males were having more muscle mass, more appendiculoskeletal muscle mass, more muscle to fat ratio, more ASMI, that is appendiculoskeletal muscle mass index, and hand grip strength. And but we found that it's only four patients were having low hand grip, but it was not that statistically significant. But what we interestingly, when we segregated the data, age group categories, 20 to 30, and then so on, what we found that as the age progresses in the males, the grip strength decreases, which was statistically significant. But in females, it remains somehow constant because we think that after 30s, males are usually having office work, but the females are morely involved in the household work and market work, so they have some amount, they preserve their skeletal muscle mass. Similarly, in appendix skeletal mass index, but there were no patients we were able to diagnose with sarcopenia according to AWGS 2019 guidelines criteria. And if you see the age-related changes in the study, the correlation of both ASMI and muscle strength, so we found that in males, both muscle strength and ASMI exhibited a negative correlation with age, which was statistically significant. And in contrast, in females, this was statistically significant with a positive correlation. So as the age, the females do not lose their skeletal muscle mass as the males does. So this was the North Western Adelaide Health Survey, which you can see in male men, they are losing their hand grip strength all over the world. But if you see the women, they have a persistent hand grip strength. This was consistent with our data. And if we correlate with the BMI in and fat percentage, so the more the BMI, it was having a positive weekly positive correlation. But if the body fat percentage has increased, so it was having a negative correlation, so that if the body fat increases, your muscle strength decreases. So if we now see if the effect of skeletal muscle mass on muscle strength and grip strength, and we have modeled this adjusted for sex, age, and BMI, we found that there's a relationship between skeletal muscle mass and muscle strength, including grip strength across the different muscle groups, revealed a consistent positive association. So if we adjust the model, there's a positive correlation what we had found. So at the end, the study demonstrated a positive correlation between skeletal muscle mass and muscle strength.
So as you exercise more, your muscle strength will increase, and specifically hand grip strength. And even after adjusting sex and age and BMI, there was a positive correlation. So, and we also found that percentage body fat is a potentially better marker for defining obesity. And there was an inverse relationship between hand grip strength and body fat percentage. So as your body fat increases, your hand grip will decrease. So this aligns with the other literature which is we have searched for the studies. And so that to conclude, the muscle strength is closely linked to muscle mass and inversely related to body fat. Hand grip strength can be simple but yet effective overall body composition. And hand grip can be a potential clinical tool for evaluating muscle mass in aging populations, especially in male, as the studies more than females, and it's an implication importance for clinical assessment and preventive health strategy and policy making. The limitation for our study was there was a cross sectional, so we were not able to make some causal inferences, and we had to use indirect calculation equation to calculate appendicular skeletal muscle mass, and the sample size were limited for this patient. So we used this age independent equation to calculate appendicular skeletal muscle mass, as this value is not given in bioelectrical impedance analyzer. So we used this equation by which we calculated appendicular skeletal muscle mass. Thank you.